Cervical cancer is the cancer of the mouth of the uterus, which is the second commonest cancer of women in India. Around 75,000 women die of cervical cancer every year in India alone. In fact, this is one of the very few cancers against which they have made a vaccine which can actually prevent the cancer. So you should be aware about how to get yourself screened about and to take the vaccination if you are in the age group which is eligible to be prevented by the vaccine. Pap smear is a simple test which is done in the OPD by a regular gynecologist, which can screen any unhealthy cells of the cervical cancer, and that should ideally be done from the time you are sexually active till 60 years of age. In pap smear also we have more technology now, something called liquid based cytology or even a HPV DNA screening which can add information to the pap smear and tell us whether you are at a risk of developing the cervical cancer later in life or not. In case we find something abnormal, it can be easily treated and you can prevent getting a cancer later on. But once the cervical cancer turns cancerous, as it presents later in the stage of stage 3 and not many symptoms are there, and then it turns like any other cancer, very difficult to treat. There's a vaccination available around cervical cancer which you should get in touch with a gynecologist, which is recommended from 9 years of age till 45 years of age, and you can take it and bring down the chances of getting the cancer later in life. Thank you.